baby, let's talk sex tonight. Ooh, cause it feels alright. Hi everyone, welcome to Vibes with Dr. Ruth Grace, and today we are talking about sex after pregnancy. Yeah, I promised you guys that from our last podcast we'll talk about this because, well, talking about self-care after birth, stage war, discharges, kati now the big question that came up was, when is the right time to kwe picha? Over to have sex after you have given birth. Now, this is a very contentious subject. Abambabuza, atekatichi, umelomwami abagamba, and now you know after I give birth like this, do you know what has happened? Is the next thing is to do what? Is to have sex. Why not? I've been waiting for 9 months. Well, some men actually wait to have like sex the entire time throughout pregnancy. And they said now the baby is out, so it's time to have sex. The answer is your woman bleeding? If she is, well, you have to wait. And then there's something else as well. Now, after birth, some men may say, okay, fine. If she had a cesarean section or if I had a cesarean section, then it's okay for me to have sex. Well, you also bleed after you have had a cesarean section. I think you learned that from our previous podcast. And some men also think that, well, Mlongo says that, well, it's going to be easier to have sex after birth because, well, maybe her vagina did not enlarge because she was pushing the baby out. Most women have concerns when it comes to delivering after giving birth. The next question is, when am I going to start this sex? When is it safe? Do I feel okay? Now, Bamlongo says that most times they ask, if he's having sex, will I have a problem with my wound? Will it open up? What is going to happen? Which position is more comfortable? The answer is, I cannot tell you the best position to have sex with. I cannot tell you the best style. The answer is, are you comfortable? So usually what do we advise? If you had a cesarean section and you're considering sex after birth, okay? We only advise for you to have sex after birth after you have finished your bleeding. Now, most times this bleeding, like we explained in the previous episode, I hope you watched it. If you haven't watched it, please go and check it up on our pages at Richer Hand Uganda and then also at Dr. Ruth Grace. So, wobango mazokuzala after cesarean section. What happens that most times the bleeding may take 2 to 3 weeks, but it can happen. Sometimes you may have some spotting. After you are done bleeding, you are clear to have sex. However, if you feel uncomfortable and for some reason you have any persistent pain in your tummy, you're not okay with it, then kindly share with your partner. The best thing to do is be open with your partner. Now, I know, yes, someone may say, well, we are married or maybe we've been living together, we already have a child together. Why would someone be shy about talking about this? The question is that as that date, a new experience to have, even if she has given birth before, it is something about after giving birth. And that discussion is usually hard for both moms and also for both the fathers. But have that discussion, be open to each other. Share and say, I'm not yet ready, I don't feel okay. And usually we expect that a woman can begin her sexual intercourse even after like 3 months. Most times women are not comfortable in the first month, second month. But if it reaches the 3rd month and she's still not comfortable, beyond 3 months, we encourage that why? Because sometimes someone can get anxiety to have sex. Sometimes they have fears and sometimes they actually need what they call therapy. And it's what they call sexual therapy. It is okay to have sex. Now, what else? If you have had a vaginal birth, now this one comes with very many intricacies. Most times you're wondering, well, should I... If I got a tear down there, olumo bakusala okuyisa ochi omwana kugazia once wayisewo omwana naye ne bakutunga. Now you're wondering, now what if I'm having sex and then the stitches come out? The answer is yes, the stitches can come out when you're having sex, and that is why we usually tell men, even after 1 week, it's not enough. It's not enough time for a woman to have healed in her private parts, in her 1%. She needs to have time for all those stitches to actually even disappear. Now, those stitches sometimes take about 2 to 3 weeks. And by that time, also the bleeding has reduced. So, omuchala, wabanga tali comfortable nga ulira nti, nedda, maybe I'm still feeling, maybe I can have stitches, I'm still feeling some pain. Honestly, acknowledge what she's feeling. Acknowledge her pain. Waliwo omuntu omukyala ayinza ogenda naawona obulungi naye nga bamutunga wansi and she still has pain. Ekiwundu kiba kiwundu. Naye sometimes waliwo ebiwundu ebibeerawo ne bitandika okukuluma nga n'oba olina enkovu naye enkovu ekuluma. Sometimes can happen to mothers and then they have what they call pain during intercourse, which in the medical form we call it dyspareunia. Now that is pain during sexual intercourse. Now, sometimes women can get pain just on the outside. On the outside, just by touching her, she feels a lot of pain. Such because it's not because what? It is because she's actually in pain. Now, usually like after 3 months, so that means she can come back to us and then we check her. And then the other thing is, well, what if you gave birth naturally? You did not tear, you did not have any, any cuts. When can you have sex? The answer is the same for you. We wait for you to first stop bleeding and to also first heal. After you have given birth, it's not only like your vagina that enlarges. Everything in your body has been big. Your cervix is still open. Now the cervix is the part that opens it. Centimeter maker. Idea that place is closed normally when you don't have a pregnancy, and also when you're not bleeding during your menstrual period, it is closed. Now what happens after birth is that most times it stays open for even like up to 2 centimeters. Which are 2 centimeters? Somewhere there. Now, when you have sex early, well, when you ejaculate, semen is still called a foreign body in a woman's what? In a woman's body. A foreign body is something, okay? It's something that can make that can spoil something with the health, can spoil something with the pH, how the pH in the vagina is maintained, and and how the body fights infections. So now, if a woman's uterus is still open and someone is having sex, if that sexual partner is having any infection, what happens that there's an increased risk for them to get an infection that goes up not only where they were cut, but it also goes up through the cervix. Then we end up with infections, what we call postpartum endometritis. Sometimes we not even have sex, and then they just have that condition. Now it's very important for you to give the body time to heal. And in point, in our previous episodes, please, if at any time you feel any funny discharge has come up, it's not because you had sex, neither. Just because a discharge has happened, sometimes an infection can occur out of nowhere. Come to us and we check you up in regards to that. The other thing is you have very many questions. Okay? Now, sometimes, yes, the truth is that sometimes the uterus, which is the womb, pushes a little bit down, okay, closer to where your vagina is, sometimes after birth. And that is why you see, it is hard to pee, or some people, it is hard to control your pee. Toilet, but you can't what? You can't hold your pee before you reach the toilet. That can happen. What we do is we advise you to do a bit of Kegels. You can always Google and find out maybe a YouTube channel that tells you how to do a right Kegel. Or we shall share in our comment section and give you a link on how you can learn how to do a Kegel. Okay. Now, these ones help you to at least make those muscles there very firm, okay? Our muscles down there. Now, Kegels are not for only women who have given birth via vaginal birth. Even a Kegel can be done by someone who has had a cesarean section. Because in pregnancy, your whole body relaxes. That's why we always say by the way, temumenya. We shall talk about that in a different episode. But okumenya. Okay? Now, what you have to know is that the body releases a hormone called relaxin. And this hormone, just like you have had, relaxin, makes the body relax. Now, when it does that, it makes every other part of the body also relax. Now, what happens that most times our muscles, okay, in our private parts, like in the vagina and also outside, they tend to get relaxed. So, mommy oluma gamba, but no, my wife is not the same after she has given birth. The answer is yes, she's not the same. But if you realize she's not the same, what you do about it is you're not supposed to go and look for another sexual partner, okay? What you do is you can encourage her to visit a healthcare provider, and then she can also start off with some Kegels. For some women, the gapping may be too much. Now, well, and then sometimes you may tear. No, you can't once. Nenga tuwali nomi yakola chi yalaba nchi wairuka abamba iruka nebataye musai. Or sometimes depending on where you gave birth from, some people zalida mu gundi mu byalo, abamba zalida where no one is going to like maybe observe a lot. Kati wamaze okuzala omusawo nakebelako nenga natalaba nti gundi wairuka. Nenga gwe naye obuyanga manende waliwo obuzibu. Come and we check you. If you feel comfortable, nti bagende bakebeleko mu dwaliro eddala, please do so, okay? And most times if it was a tear, oba wayiruka bubi nga tebakutunga, what we can do is there is surgery available for you. Where the opening is, where the baby comes out from, is very close to where the other opening is, where poo comes from. Now it's very thin. Now some women tear in that area completely. Katnosanga, nga the back door is closed up with the where baby is coming from. So now the man does not know, or he's just like, you know what, when they're having sex, they're just going, you know, left, right, and center. So I mean, you have to know where you are going, okay, when it comes to having sexual intercourse. Now, if you notice a young woman is for some reason wider than she is, sometimes younger women may not realize that they actually have a problem after birth, and it is important for the partner to tell them. And if they realize that is a problem, they're supposed to come to a health facility, and then we check them up. If you feel like you delivered at a health facility, you're not going to get the care that you need from there, we advise that you can visit a general hospital in Uganda, a national referral hospital, also maybe a regional referral hospital, and then you get the care that you need there. Bakkeberako wansi, olumu oba wataka okulongoosa bakola ki? Bakugambako ne bakulongoosa. Otereera noddawo. Now someone can say, what if I told her the other time? Will I tear again? The answer is yes, sometimes you may tear again, and then sometimes you may not also what? Tear again. Ate abami, if your wife is not ready to have sexual intercourse, well, remember a time when you were dating her, before babies happened, before anything happened. Now is the time sometimes to also bring that mood back in, because a woman is not only dealing with only one thing by Ikamsai, she's dealing with other things. She's dealing with, there's a baby that is crying. She's dealing with the breast milk that is overflowing. For some reason, one boob is bigger than the other one is small. Maybe the breast milk is actually not coming at all. She's dealing with being overwhelmed. I have to go back to work, or I have to take care of the baby. Baby takaba nnyo. Ate kati omuyingira mu obwoka, when kitabukira ddala. She is stressed. A woman cannot enjoy sexual intercourse when she's stressed. Like, that is it. Normally, even without having a child, if a woman is not comfortable, she will not be able to enjoy her sexual intercourse. You have to prepare them slowly, gently, and then encourage her. Sometimes being a supportive partner also helps. Ntikale kankuyambeko kati ntomchala kankuyambeko baby nga yonka gwenawe wummulako. Kankuyambeko kuchomwana okuchenyenga diaper. Kankuyambeko kuchusengo ezo omwana. Kankuyambeko kunazo omwana. All that time at least you're giving her time to rest. So by the time you bring up the topic of naye muchala kati omanyi eri ensonga, well, she is also, somehow rested, and you're also happy, and the baby is also comfortable. Well, when children come in, I know, of course, sex lives change. There's always that topic of newabanga achali baby kati yebasemu atabana bebakamu kati check up ne bakola ki ne bazokuka. Sometimes they sleep only 1 hour. During that 1 hour, if you feel like it's a time to actually have sex, please have sex. But remember, during that 1 hour, when she's also relaxing, when the baby is sleeping, it's the best time for her to also what? To also relax. So you have to find a way of making things work, not on only one side, but also for father and mommy to work out things well with the mother resting, and then secondly with also having to have sex. The other important thing that you have to know when it comes to having bedroom matters after you have given birth is, one, if she has had a cesarean section, or even after birth, she's very cautious about her body. The body has changed. She had a whole baby or babies inside her what? Inside her tummy. It is normal for someone to feel like, banange, how do I look like now? Do I look like I'm ugly to him? Do I look like an elephant? Some people just say, oh my God, my tummy is too big. And women, it is normal for your tummy to be big after birth. Some people expect what we see in the movies, that you've just given birth. The answer is no, it takes time. You may even look pregnant, more pregnant than you were after you have given birth. The tummy is still there. So men, you have to understand and tell your woman, remind her that now she has a postpartum body, okay? She has a postpartum body. It is a new body for her. And when she appreciates that body, she's then less likely to be self-cautious, and then initiating that conversation when it comes to sex is becomes what? More comfortable. Nagamba some people even prefer, and I think that's why many of our elders in those old days, what they would do is that they would take away the woman to agende abere wani ewa wa mama. Wabatabetali wa mama agende wa mama wo mwami namulabirira. So why during that time is just another way for contraception to happen. It's natural contraception that when you abstain, you're not going to have a child, of course. Now, how do they prevent pregnancy in the near weeks after you've just given birth? Banga we know. Ofunya you discharging obanga discharge yo musaying or child bleeding ngo mazokuzala, you can still get pregnant. you can. No, but you can still what? Get pregnant. So yes, it's a family planning method, but it's not 100% okuyonsa. The best thing is to abstain. Right now in the current times, we have this part of you're a working mother, or maybe sometimes you don't even have a mother-in-law. So what happens that you stay at your own home, so you're with your partner. He's also confused by the way. You just remember that part. He's also a father, a new father. He doesn't know what it is. Even if you've ever had a child before, he's also figuring out life with a second child. Also saying, oh my God, we have a second one. Maybe you have a third one. Okay. Now, during that time when you guys ideally should be apart, now you're looking at each other. You have a newborn that is stressing you. Honestly, tell me when it is comfortable to have sex. The answer is it is not. But however, talking through it as a couple, one is self-appreciation of your body. Like, it's okay. Your body is changing, has changed. You're giving, you're helping us. You're helping nurture our baby. You're helping raise our baby. You're giving birth to our baby and we are comfortable. And of course, let's say she has healed. Some women heal faster. That is okay. 1 or 2 weeks. And then ask her, just because she'll stop bleeding, that means she's not comfortable with what? With having sex. So are we comfortable with this? Do not forget, your placenta period is from the period of after giving birth, immediately after birth, and then up to 6 weeks. However, we also go ahead beyond the 6 weeks, and then we have to go up to 6 months. So all that time we can consider and say this is a postnatal what? Period. However, consider up to 6 weeks, because the first 6 weeks are the most difficult times when you can bleed a lot, when something can change. You still have questions about you still have questions about bleeding. Anything can happen during that time. So, and during that time, we advise men, please, if you can wait. Now, bana abachala nga yayiruka bubinyo abo tubagamba no baga malina ko myezi mukaaga. Kati omumbe gaga myezi mukaaga msawo. How can I wait for all this time? The answer is yes. There are different stages of tears, and we can share a picture with you in this clip. The different stages of tears. When you work sometimes just a stage 1, okay, or a type 1. Then there's a type 2, a type 3, and type 4. Kati omukyala oba wayirukako wansi. Oba baba bakusalako wansi. You have a right to ask your healthcare provider, naye musawo nayiruka paka wa rachi. Kubanga wofuna yo type 3 ne type 4. Ekibaawo kiri nti woluto oluddako, we have to decide. Will you deliver again vaginally, or will you go for a cesarean section? Sometimes we say, okay, fine, katugezeeko tulabe. Naye bw'oyiruka neera ali n'oyiruka kintu kyekimu awo tugamba nedda baajjukira nga twogedde. The other place where poo comes from and where a baby is coming from are all in a very near place. So if you keep on tearing very close to where the poo comes from, what happens with time is empage what they call the sphincters, they let loose. And you're not able to control your poo-poo, and that's what we end up. Some people call it a fistula, okay? But a fistula where a poo-poo is coming out of your private parts, because the two places are not connected. Other people also end up having just incontinence. You can't hold your poo bag. All the time, if in case I have diarrhea, we just like had poo-poo, that one just goes away. You may need to check with your obstetrician about it. So during that time, it's very important to ask your healthcare provider and at extent. It also guides your next healthcare provider. Sometimes we deliver from our place. The next time I'm delivering, you're going from a different place to deliver. You want to find, the other provider also wants to find out what happened in your previous pregnancy. So if there's a very significant tear, and even had to go to theater into ekyokufikisinga omusawo mugambe ko mugende naye nayiruka sikwiruka cervix ekyo kirala tujja byogerako ewalala. This is kuyiruka ki wansi ng'omwana avaayo, okay, like outside our flower you tear. That is a place what we're talking about, and it's a very crucial place for people, because that's where most pain is, even when they are having sexual intercourse on that outside part of our flower. So if you have any questions, if I haven't addressed anything about sex after pregnancy, please let us know, okay? The other thing I wanted to cancel about is following our previous episode. Some people asked me, is it safe to use a tampon after I've given birth? The answer is no. Do not use tampons or put anything up in your vagina after you've given birth. We advise that if you've been using tampons, first hold on at least for the first 6 weeks. Let that bleeding come out. Let all that discharge come out because your body is healing, because tampons tend to raise your rates of infection. So we avoid them. Even if it's a menstrual cup, or you take out collecting a blood, the answer is we avoid those ones, and then we just use the pads, because those ones are able to help us to understand and to realize that, Neda, something is off here, something is this here. So do not use tampons and not use menstrual cups immediately after you have given birth for the first at least 6 weeks. Thank you very much. For any more questions or concerns about your body, about your partner, and about, well, safe motherhood and also self-care, follow us on our TikTok pages and then also our YouTube page. That is at Dr. Ruth Grace and also at Richa Han Uganda. And shout out to Sauti Media team for the camera tonight and the cameraman behind here. Thank you for following our podcast, and tune in for the next episode next Friday at 4 p.m. with Vibes with Dr. Ruth Grace. Thank you.